Well, a big step for a sometimes frightening childhood illness. The FDA today approved a new drug that can protect kids from RSV. Colorado saw a dangerous surge in cases last year. During the peak, which lasted through November, 835 children were hospitalized, and of those, 36% ended up in the ICU. Karen Morfitt is at Rocky Mountain Hospital for Children Forest Night. So, Karen, this brings a lot of hope for parents and for medical workers who treated all of those sick kids.
Yeah, Karen, and until now, there have been few options to protect against RSV. We've shared numerous stories of families who have seen the worst of this virus. Tonight, we had a chance to catch up with one of them. Unfortunately, it had to be virtually because they're now dealing with COVID, but they did say they are excited to hear that there is now a new tool to protect other families. Last fall, the Maples were living day to day.
We're looking for any sort of light at the end of the tunnel.
We spoke with them in November as the cases of RSV skyrocketed across Colorado. Their 4-year-old daughter, Meadow, had contracted a severe case and had to be intubated for 8 days.
Those 8 days were the longest days probably of our lives.
Dr. Karen Wolf is the medical director of emergency at Rocky Mountain Hospital for Children.
Without question, that was the most significant RSV season I've ever seen.
The FDA's approval of a drug designed to prevent RSV in infants and toddlers, she says, will be a huge benefit, not just for families, but for hospitals as well.
It was a major tax on the system. We literally ran out of beds.
The drug is different from a vaccine, which works to help your body build antibodies. This, she says, is an already made antibody.
It has about a 4 to 6 month duration, the hope being that it will get you through the bulk or all of RSV season.
After nearly a month in the hospital, Meadow was released on Thanksgiving and wanted just one thing.
Stop on flapping.
A moment of joy her parents say they'll never forget. After an experience they hope, with the help of this new drug, other families can avoid.
I really, really hope that people don't have to experience what we did.
Now, there is a similar drug available right now, but it's only available for at-risk infants, those who are born premature. This would be for all infants and would offer a second dose that could be given to children up to 2 years of age. The FDA approval sets the stage now for the CDC to weigh in and move this forward and to sign off on this drug, and they are expected to do so before fall, before the next RSV season is expected to hit. In Denver, Karen Morfitt covering Colorado First.
Karen, thank you. And Karen and the rest of our team have covered RSV extensively since last year's surge. You can watch all of those reports and get some good advice for parents at cbscolorado.com.